Hello, future nurses. Welcome back to Manvitar and Talks. Today, we are covering one of the most high yielding interest topics that is infection control precautions. So, if you don't know the difference between standard, contact, droplet, and airborne precautions, you can lose easy marks on your NCLEX exam. So, stay with me till the end. I will give you simple mnemonics, NCLEX traps, and practice questions. So, let's start with the standard precautions. These are the precautions that are used for all patients, no matter what disease they have. So it basically includes hand hygiene before and after every patient contact, gloves, gown, or mask if exposure there is risk of exposure, safe sharps disposal, and respiratory hygiene and cough etiquettes. So, NCLEX tip here is standard precautions apply to everyone. Never confuse it with the contact. So next is contact precaution. So that precaution that is used when infection spread by direct or indirect touch. So disease basically includes MRSA, that is methicillin resistance staphylococcal aureus. That is the type of bacterial infection in that the bacteria has become resistant to many commonly used antibiotics, including methicillin, oxycillin, penicillin, and amoxicillin. So, MRSA is a common cause of hospital-acquired infections, but it can also occur in the community. So, it is spread mainly by direct contact. That's why patients are kept on the contact precautions. VRE, C. diff, scabies, RSV, impetigo. So in this we use personal protective equipment, gloves and gown always. Room, the patient will be kept in the private room or cohort means combine the patient in a one room. So two patient can stay in a one room. So transportation is very limited patient movement here. So very important here is dedicated patient care equipment. So that means stethoscope, blood pressure cuff, thermometer, pulse ox, or even bed pen. All are kept just for the one patient. So if equipment must be shared, that then it should be disinfected before using on the other patient. So NCLEX step is here for CDF. Hand hygiene must be with the soap and water, not alcohol sanitizer. So you can remember the mnemonics here, Mrs. B. So MRSA, RSV, skin infections, wound, enteric infections, eye infection, they all are come in the contact precautions. So next is droplet precautions. That is very important. Now let's talk about it. So these are the infections that are for the infection that is spread by large droplets for more than 5 microns. So which travel up to 3 feet. So they are the basically droplet precautions when where we use droplet precautions. So diseases it includes influenza, mumps, rubella. You can remember MR pertussis, meningitis, diphtheria, adenovirus. So in this we use PPE surgical mask within 3 feet. So gloves and gown if secretions are exposed. So in the room we just say in private or cohort. Transportation patient wears a surgical mask. It is very important. So make you should write down. So when transporting a patient to the another unit, so patient should wear a surgical mask. NCLEX trap is here. Many students think flu is the airborne, but no, influenza is a droplet. So when the influenza it comes in exam, you should always take the droplet precautions. So mnemonics for here, you can remember droplet infection are Spider-Man. So as for sepsis, scarlet fever, and strep, pharyngitis, pyrovirus, or pneumonia, pertussis, influenza, diphtheria, epiglottis, rubella, mumps, meningitis, and adenovirus. So you can remember Spider-Man. Next is now the most tested one is airborne precautions. So these infections spread by tiny droplets nuclei less than 5 microns, though that can stay suspended in the air for hours. So diseases include tuberculosis, measles, chickenpox, or disseminated herpes zoster. So in the PP, we use N95 respirator or higher. Room is always its patient kept in the negative pressure isolation room, and door is always closed. So transportation during when patient in this during transportation of the patient wear a surgical mask, note N95. So NCLEX strap is here always. Patient wear surgical mask, and the staff which is caring for a patient personal health, personal protective equipment is N95 mask. So only healthcare workers wear N95, not the patients. So mnemonics here, you can remember my chicken has TB. So you can remember the mnemonics here for measles, and for measles, chicken pox, herpes, just and TB. So let's do a quick recap with the table so you can remember. So for the standard, that is for all patients. So personal equipments as needed, room and so for the contact precautions like MRSA, C. diff and RSV, we use PPV gloves and gown. So room is here private or cohort, or patient transportation is very limited. So in the droplet patient, like for example, flu, mumps, meningitis. So PPE wear is a surgical mask, room is private or cohort, and transportation is by the surgical normal mask. Airborne, the like TB, measles, or varicella. Personal protective equipment is from the health personnel wear and 95, and patient is kept on the negative pressure room, and the patient wears surgical mask during transportation. So that is very easy. You can remember all these. So next we will do some practice questions so you can remember in the exam. So let's test your knowledge. So question number one, a nurse is caring for a patient with active TB. So what is the priority? So wear a surgical mask, place in a negative pressure room, cohort with another TB patient, wash hands with alcohol-based sanitizer. So correct answer is B, placed in a negative pressure room. The patient should be kept in the negative pressure room, and wear a surgical mask is incorrect because healthcare personnel should be wear N95 mask. So cohort with the another TB patient. So cohort is not should be not done. Patient is kept in alone in the negative pressure room. So wash hands with alcohol-based sanitizer. No, wash hands with the soap and water. So correct answer is B. Next, which infection require both contact and droplet precautions? So correct answer you can select from these options: TB, RSV, MRSA, and chickenpox. So comment your answer below. So a nurse is caring for a patient that is diagnosed with MRSA wound infection. So which action is most appropriate? A, place the client in a negative pressure room. B, dedicate a stethoscope and blood pressure cuff for a patient. C, wear a 95 respirator when entering the room. D, place the patient in a droplet precaution. So correct answer is B, because MRSA require contact precautions. So gloves, gown, and dedicated equipment should be remain in the will be used for one patient. So negative pressure and N95 are for the airborne. Next question. Which hand hygiene method is best for a patient with Clostridium difficile? So A, alcohol-based sanitizer, B, soap and water, wearing gloves only, D, antiseptic wipe. So correct answer is B, because C. diff spores are not killed by alcohol, so only soap and water is effective here. Question number next. A client with influenza is admitted. What precaution should the nurse implement? So correct answer is droplet, because influenza spread by large respiratory droplets, which is requiring a surgical mask within 3 feet. A nurse is preparing to transport a patient with active pulmonary tuberculosis for an X-ray. Which action is essential? A. Ensure the patient wear a surgical mask. Place an N95 mask on the patient. C. Place the patient on contact precautions during transport. Cover the patient with a sterile drape. So, correct answer is A. Patients wear a surgical mask and the nurse wear N95 respirator. Next, which infection requires both droplet and contact precautions? A. Varicella, chickenpox, RSV, respiratory syncytial virus, C. Measles, D. MRSA. So, correct answer is B because RSV spread by droplet and contact with secretions. So, both precautions are required. So, just remember it. The nurse is caring for four patients. Which client should be placed in a negative pressure isolation room? So, a child with pertussis, an adult with influenza, patient with tuberculosis, a patient with MRSA wound infection. So, MRSA is contact precaution, just cut it out. Negative pressure room for the airborne. So, correct answer is C, a patient with tuberculosis. So, TB is airborne, that is required negative pressure room. Next, which PPE should the nurse wear when caring for a patient with disseminated herpes zoster? So, herpes zoster, yani disseminated, it is airborne. So, and we should contact precaution also. So, options are gloves only, the gloves plus gown plus surgical mask, N95 respirator, gloves and gown, the surgical mask only. So surgical mask only is cut out. So herpes zoster that include airborne plus contact precautions. So airborne in the N95 respirator, gloves and gown. So correct answer is C. All right, Aziz, that's full breakdown of infection control precautions for NCLEX, standard contact, droplet, and airborne. So we covered mnemonics, NCLEX traps, and even practice questions. So if you found this helpful, don't forget to hit the like button, subscribe to Manpit RN Talks, and share this with your nursing friends. So remember, infection control is not just for exam, it's for saving lives in a real practice also. So thank you for watching and I will see you in the next video. So keep studying, keep growing and good luck for your NCLEX journey.